Good afternoon. Friday, May 15th. It is not the Ides of May. We're here for our periodic update to the community as far as what we're doing, what we're seeing, what's happening with the COVID pandemic. I'm Alan Vandriel, CEO of Smith County Memorial Hospital. With me is Sarah Ragsdale, Chief Nursing Officer. We have just a few things we want to talk about today, mostly just to reiterate things that you probably already know. As I'm sure most of you are aware, the governor announced yesterday that we will be moving to phase 1.5 in her reopening plan. Phase 1.5 makes some differences to the planned progression of what businesses could reopen, but overall it stays pretty much the course of what we had planned anyway. Our discussion revolves around what changes does this new phase mean for Smith County Memorial Hospital. The phase 1.5 makes very little difference to Smith County Memorial Hospital's operations. We will still maintain the safety precautions that we put in place early in the pandemic. We will continue to screen all patients, visitors, and staff coming into the facility. We will continue to restrict visitors to the inpatient part of the facility. The things that we want to focus on as far as the progression goes have to do with the maintenance of your health. We are safe in this facility and in this medical practice, and we want to make sure that we encourage those of you who have ongoing health care needs to get the health care that you should have on an ongoing basis. Our physicians are still seeing patients every day. They are feeling like things are very safe in the clinic and in the hospital. If you have needs, if you need to be seen for an ongoing or an acute illness problem, they are there to see you, and they're happy to take care of all your needs. If you develop symptoms that you think might be attributable to the COVID disease, we ask that you call before you come to the clinic, and we'll make accommodations to treat you as safely as possible without exposing other people who may be in the waiting room or in the clinic at the time that you come. But we don't want you to delay care because you're afraid to come in because of the pandemic. Likewise, if you need to be seen for something that's not related to COVID, we definitely want to encourage you to continue to come and have your medical appointments. Sarah, do you want to talk a little bit about our ongoing infection prevention and safety protocols?
Sure. Just a reminder to everyone to make sure you're doing good hand hygiene, social distancing. If you meet in groups of less than 10. When you come to the hospital, call before you come if you feel like you're having COVID symptoms and you need to be seen in the ER. We are doing a little bit of pre-screening for COVID for surgical procedures. That's been a new requirement for some providers. Again, you'll just call to make an appointment for that. We'll be screened at the door, and we'll take care of your needs accordingly.
We are seeing some patients contact us because they're planning to have surgical procedures done in other facilities that have more stringent screening requirements than we do. Some facilities are requiring that all patients undergoing surgical procedures have a COVID test prior to the procedure. We are not requiring that 100% here because of the low incidence and not having community transmission of the disease here. But we're happy to provide testing for people who are going to have surgery performed other places and where it's more convenient for you to have the testing done here. So your surgeon that's going to do the procedure can send us an order, and we'll do the testing here and get the results to them so that you can go forward with your surgical care. Other than that, as I said, Phase 1.5 really doesn't change very much at Smith County. We're continuing with all of the safety measures, and we believe we're doing a good job of taking care of patients and keeping the community safe. And we want you to do your part with that, so we just ask that you follow all of those things that Sarah talked about and be safe out there. As the weather turns warm, it's more tempting to be outside. Continue to practice social distancing, be safe, and we wish you a good weekend.